All right, folks, let's talk about something really important today: the impact of childhood abuse on mental health. Whether it's physical, emotional, or sexual, childhood abuse is incredibly traumatic and can mess with a person's mental health for a long time. The connection between abuse in childhood and developing mental illnesses is super complex and involves a lot of different factors like biology, psychology, and social aspects. Understanding this relationship is key to figuring out how to prevent and treat these mental health issues. Childhood is such a crucial time for emotional and psychological growth. It's when kids learn to trust others, build relationships, and feel secure and valued. When a child experiences abuse, this whole process gets thrown off track, leading to a bunch of emotional and psychological problems. Abuse can come in many forms: physical violence, sexual abuse, emotional mistreatment, and neglect. Each type of abuse affects mental health in different ways, but they all have the potential to cause serious harm. One of the first things that often happens after childhood abuse is the development of anxiety and depression. Kids who are abused often live in constant fear and uncertainty, which can turn into chronic anxiety. They might feel hopeless, trapped, and helpless, which can lead to depression. These feelings don't just go away as they grow up. They often carry these issues into adulthood, dealing with things like generalized anxiety disorder, panic attacks, major depressive disorder, and other related problems. There's a particularly strong link between childhood abuse and post-traumatic stress disorder, or PTSD. PTSD can develop after someone goes through a traumatic event, and childhood abuse is one of the biggest triggers. Symptoms of PTSD include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the trauma. For kids, this trauma can take over their daily lives, making it hard to concentrate, sleep, or do normal activities. As they get older, these symptoms can get worse and make it really hard to function in everyday life. Another major issue is the increased risk of developing personality disorders. These disorders are characterized by long-lasting patterns of behavior, thinking, and inner experiences that are way different from what's expected culturally. These patterns are inflexible and cause significant distress or problems in functioning. Borderline personality disorder is one such condition that's closely linked to childhood abuse. People with BPD often have intense and unstable relationships, a distorted self-image, and major issues with regulating their emotions. The chaos and unpredictability of an abusive childhood can lead to these unhealthy patterns. Substance abuse is also common among people who have been abused as children. The pain and trauma can push individuals to use drugs or alcohol to cope with their feelings. This self-medication can quickly turn into addiction, further complicating their mental health struggles. Substance abuse can mask underlying mental health issues, making it even harder to diagnose and treat these conditions properly. The impact of childhood abuse isn't limited to these conditions. Eating disorders, like anorexia nervosa and bulimia nervosa, are often linked to a history of abuse. These disorders involve extreme behaviors related to food and weight, usually as a way to gain control over some part of their lives when they feel powerless in others. Similarly, self-harm and suicidal behavior are tragically common among those who were abused as kids. The intense pain and despair they feel can lead them to hurt themselves as a way to cope or express their inner turmoil. Biological factors also play a big role in the relationship between childhood abuse and mental illness. Research has shown that chronic stress from abuse can actually change the brain's structure and function. The hippocampus, which helps with memory and emotional regulation, can shrink because of long-term exposure to stress hormones. The amygdala, which processes emotions like fear and pleasure, can become overactive, making it hard to manage emotions. Additionally, the prefrontal cortex, which is involved in decision-making and impulse control, can be negatively affected. These changes in the brain can make individuals more susceptible to various mental health disorders. Genetics can also influence how childhood abuse impacts mental health. Some people might have a genetic predisposition to mental illness, and when this is combined with the trauma of abuse, it significantly raises their risk of developing psychiatric conditions. Epigenetic changes, where environmental factors like abuse affect gene expression, are also being studied as a way trauma can impact mental health across generations. Social factors are just as important in understanding the link between childhood abuse and mental illness. Kids who are abused often feel isolated. They might withdraw and have trouble forming healthy relationships. This lack of social support can make feelings of loneliness and depression worse. As they grow older, their poor social skills can lead to further isolation and trouble maintaining relationships, both personally and professionally. The family environment plays a crucial role in the mental health of abused children. If the abuse happens within the family, the lack of a safe and supportive home can make the trauma even worse. Kids rely on their families for protection and support. When this trust is broken, it can lead to a deep mistrust of others and a constant feeling of insecurity. On the flip side, having a supportive family member or adult figure can help lessen some of the negative impacts of abuse. This person can provide stability and safety, helping the child cope with their experiences and build resilience. Interventions and therapy are essential in addressing the mental health consequences of childhood abuse. Cognitive behavioral therapy, or CBT, is one of the most effective treatments for anxiety, depression, and PTSD. It helps people understand and change their thought patterns and behaviors. Trauma-focused CBT specifically deals with the impact of traumatic experiences, helping individuals process and integrate their trauma into their life story. Dialectical behavior therapy, or DBT, is particularly effective for individuals with borderline personality disorder. It combines cognitive behavioral techniques with mindfulness practices, helping people regulate their emotions and develop healthier relationships. Eye movement desensitization and reprocessing, or EMDR, is another therapeutic approach that has been shown to be effective in treating trauma-related symptoms. Group therapy and support groups provide a platform for survivors of childhood abuse to share their experiences and support each other. These groups can reduce feelings of isolation and help individuals learn from others who have had similar experiences. They can also provide a sense of community and belonging, which is often lacking in the lives of those who have been abused. Early intervention is crucial in mitigating the long-term effects of childhood abuse. Identifying and addressing abuse early can prevent the development of more severe mental health issues later in life. Schools, healthcare providers, and community organizations play a vital role in recognizing the signs of abuse and providing the necessary support and resources. Prevention is equally important. Educating parents, caregivers, and the community about the signs of abuse and the importance of creating a safe and supportive environment for children can help reduce the incidence of abuse. Programs that teach positive parenting skills and provide support to families in need can also be effective in preventing abuse. The relationship between childhood abuse and mental illness is complex and multifaceted. Childhood abuse disrupts the normal development of trust, self-worth, and emotional regulation, leading to a range of mental health issues, including anxiety, depression, PTSD, personality disorders, substance abuse, eating disorders, and self-harm. Biological, psychological, and social factors all contribute to the impact of abuse on mental health. Understanding this relationship is crucial for developing effective prevention, intervention, and treatment strategies to support survivors of childhood abuse and help them lead healthier, more fulfilling lives. By addressing the root causes and providing comprehensive support, we can work towards breaking the cycle of abuse and its devastating impact on mental health. The story doesn't end here. The interplay between the various factors that influence mental health in survivors of childhood abuse continues to be a subject of extensive research. This ongoing research helps to refine our understanding and improve the support systems available to these individuals. For example, advances in neuroscience are shedding light on how the brain's plasticity can be harnessed to help survivors of abuse. Neuroplasticity is the brain's ability to reorganize itself by forming new neural connections throughout life. Therapeutic techniques that promote positive brain changes are becoming increasingly important. Mindfulness-based stress reduction, for example, has been shown to help individuals with PTSD by promoting changes in brain areas involved in emotional regulation and self-awareness. Additionally, there is a growing recognition of the importance of a trauma-informed approach in various settings, including schools, healthcare facilities, and social services. A trauma-informed approach involves understanding, recognizing, and responding to the effects of all types of trauma. This approach emphasizes physical, psychological, and emotional safety for both providers and survivors, and helps survivors rebuild a sense of control and empowerment. In schools, trauma-informed practices can help educators recognize and support students who have experienced abuse. This might include creating safe and supportive classroom environments, providing professional development for teachers on the impacts of trauma, and implementing social-emotional learning programs that help students develop resilience and coping skills. In healthcare settings, trauma-informed care can improve the patient experience and outcomes. Healthcare providers trained in trauma-informed care are more likely to recognize the signs of trauma and provide sensitive and appropriate support. This can lead to better patient-provider relationships and improved mental and physical health outcomes for survivors of childhood abuse. Social services can also benefit from a trauma-informed approach. Social workers, case managers, and other service providers who understand the impacts of trauma can better support their clients. This might include providing resources for mental health care, helping clients navigate the legal system, or connecting them with community support groups. Policy changes are also important in addressing the relationship between childhood abuse and mental illness. Advocating for policies that support mental health funding, child protection services, and family support programs can help to create a society that prioritizes the well-being of children and families. Ensuring that mental health services are accessible and affordable for all can make a significant difference in the lives of those affected by childhood abuse. Furthermore, public awareness campaigns can help to destigmatize mental health issues and encourage individuals to seek help. These campaigns can educate the public about the signs and effects of childhood abuse and the importance of early intervention and support. By raising awareness and fostering a supportive community, we can create an environment where survivors of childhood abuse feel understood and empowered to seek the help they need. In conclusion, the relationship between childhood abuse and mental illness is a deeply complex and multifaceted issue that requires a comprehensive approach to address. The impact of abuse can ripple through an individual's life, affecting their mental health, relationships, and overall well-being. By understanding the various factors that contribute to this relationship and implementing effective prevention, intervention, and treatment strategies, we can support survivors on their journey to healing and recovery. Through continued research, education, and advocacy, we can work towards a future where every child is protected from abuse and every survivor receives the care and support they deserve. Thank you for listening. I hope this discussion helps to shed light on the critical importance of addressing childhood abuse and its lasting effects on mental health. Let's work together to make a difference in the lives of those affected and to build a safer, healthier society for all.